So we're going to be extracting the maxillary canine tooth, right? So we've already done our nerve blocks for this area. The first thing we're going to do is we're going to create a flap. So we're going to make a nice broad-based flap. So you're going to make a sulcular incision, and then you're going to make a distal vertical release and a mesial vertical release. Right? And we're making these at the line angles, which is that imaginary line about where the tooth meets the surrounding bone, okay? Place that this tends to get the most caught is at the corner, so sometimes it's nice to go over those corners again. So you're going to use one of your periosteal elevators, so you'll have 3 elevators within your kit, the EX9, the Molt, and the EX7. You can see, especially when looking at this one, there's a shiny side and there's a dull side. Dull side should be down towards the patient with shiny side up to you. And you always want to hold it with a nice short stop grip, right? So you don't accidentally poke something you don't want to poke. So for this size patient, I think a good choice would be to use our EX7. Again, shiny side up, short stop grip. So then you're going to go ahead and raise your flap. See how I'm teasing the flap away? I'm not pushing because I don't want to push right through my flap. I want to tease it up and away. So now that our flap is raised, we can see the bone overlying that tooth. We have a nice broad-based flap and we have really good visualization. You don't want to be ice fishing, so make sure you have nice visualization. You're not looking in a teeny tiny hole. So now we're ready to remove our alveolar bone. So we're going to take our high-speed handpiece and then we're going to put on our 330 burr. So remember, when we're changing our burrs, we need to hit the thing on the back. So we hold it in, and then while holding it, we place our burr all the way in. Then let go and make sure it's been caught, okay? You can see on the 330 burr, it's this nice small burr that cuts on every side, okay? All right, so then we're going to use high-speed handpiece to remove that alveolar bone, and we want to be painting that bone away. You want to start by taking about 40 to 50% of the total height of your canine tooth, right? You can always take more, but you can't make it grow back. So normally I'll start by taking about 50%, and then I'll try elevating, and if you need to take more, you always can. So you want to use an elevator that's big enough that it hugs the tooth, right? So you don't want a teeny tiny elevator that's going to chip the tooth. You want one that's kind of going to hug around the outside. Again, always holding your elevator with a short stop grip so you don't poke a dog in the eye or the brain or somewhere else you don't want to poke them. So you're going to come up along the side of the tooth. You need to wiggle your elevator up kind of as far as you can apically, and then you're going to work on stretching that periodontal ligament. Once you have a nice leverage point, you're going to hold it for 10 seconds. You're going to allow that periodontal ligament to stretch. You don't want to wiggle, because that's what our teeth do every day. So find a good leverage point and then work on stretching that periodontal ligament. So I was having a tough time, so now I'm going to take more alveolar bone, which is totally fine to do. You can see this time I'm also making a moat. So I'm making a space for my elevator to go. You can definitely make a moat to make it easier to find a leverage point, but be aware that if you make that moat too wide, you're not going to get any leverage. So then again, we're going to use our elevator we're using before that's going to hug the tooth. And we're going to shimmy it up against the side of the tooth and stretch that periodontal ligament. Once your tooth is finger loose, right? So we could pull it out with our finger. That's the only time you can reach for your extraction forceps. These are an extension of your hand. They are not to grab a tooth that's not loose and pull it out and break the tooth, okay? So when you're ready, you're going to put it as apically as possible on the tooth, and then with nice good pressure, you're going to pull outward with a teeny little twist at the end, okay? Did you see how I wasn't flapping it in the breeze? I was just one swift movement with the turn at the end. So you take your tooth out, you're going to rub it on your hand to make sure that the root tip doesn't feel fractured. It feels nice and soft. And you would also take a radiograph to confirm that, correct? So now, what we're going to want to do is we're going to smooth this alveolus because you can see it's really roughened, right? No one wants to chew on something that's that rough. So now we're going to use our diamond burr. And again, to change the burrs on our high-speed hand pieces, we hit the thing at the back, we push it and hold it to pull this burr out, and while still holding it, we can put our other burr in, right? And then we can check that it's in. So now we're not trying to take away any more bone, we're just trying to smooth the alveolus. Just so it's soft enough to the touch, okay? All right, so now we want to close our flap. Remember, the #1 enemy to a flap healing is tension. So we need to release the periosteum. So you want to hold your flap up, and this is the periosteum here, this white stuff, the bottom of the flap. So I like to use scissors to come from the side of the flap, stretch that periosteum. Once I know I'm not going to totally cut my flap off, I'll go into that pocket, see? I'm out of the way, and I'll cut across. Did you see that when I made that cut, all that extra stretch we got on that flap? Right, and then you can do a little extra blunt dissection if you need, okay? But now we can lay our flap down, and there's absolutely no tension. So now we're going to close our flap. We're going to do simple interrupted sutures, 2 to 3 millimeters apart with 5 to 6 throws per every knot. So we're going to start at the corners, right, and tack those down so that we know that our flap is going to close nicely, and then we're not going to totally close one side and then not be able to close the other. Remember that you want your knots really short. So once our corners are tacked down, now we know that we're going to have good closure of our extraction site, and then we can close up the rest in any order that we'd like. You can always lift off the gingiva and mucosa over here as well as on the mesial side if we need to for good closure, but often then that's not necessary.